This is a big milestone for AAR Healthcare, and actually to give us more information on the same, I'm joined by the chair, Daktari. We know you in other forums, but introduce yourself in the capacity at AAR.
Yes, my name is Frank Njenga, doctor, and for the last 12 or 15 years I've been chairman of AAR Healthcare Group. We are a very, very old healthcare delivery company. We trace our roots back to 1984. Hear that one. We operate now in Kenya, Uganda, and Tanzania, and we have a total of almost 40 clinics. In conformity with universal healthcare intentions or practices for this country, we are hoping to open another 3 clinics in Kenya before the end of this year, and we'll continue to do that over the next few years. In Uganda, we have 3 hospitals, no, 2 hospitals in Uganda, and our hospital in Kenya on Kiambu Road is at a very advanced stage of construction, and by September next year, this city of Nairobi will enjoy an additional facility of 118 beds, fully equipped with intensive care and so on. So really, we as a group are committed to partner with the government in the delivery of universal healthcare. We will play our full part and role from the private sector side. Of course, we are also very deeply involved in training. We have a very large number of young and some older doctors and nurses. So really, we are very proud and privileged to be able to say today that we are proud Kenyans and are opening our 21st clinic. Our partners, interestingly, include international organizations. IFA is our biggest investment fund for health in Africa. We have partnered with IFC, the World Bank affiliate. We are together with the Swedish development organization, Swedfund. So really, not just the local shareholders, but also international shareholders. So we are a big and growing group, and we are happy and privileged to be able to work in this very happy Republic of Kenya.
Okay, Daktari, we seem to see a certain strategy in as far as how you place your outpatient centers. They are getting closer to the people in the residential areas. What is the thinking behind that?
Initially, we were what one might have called an elitist organization that lived in an ivory tower. We've decided over the last 10 years that we must be where the people are. And that, interestingly, means that our next clinics are, for example, in places like Kikuyu, where the real people live, Utawala, where real people live, or Ngatarongai. So our strategy is to ensure that ordinary Kenyans have access to the very high quality medical services to which we believe they're entitled to. And our strategy, therefore, is to go closer and closer to the homes of Kenyan people.
Also, the setup of these outpatient centers is very unique, where you consider certain parameters in as far as providing these health services to that patient. Speak on the same.
Well, I mean, as you can see, we have 30 years plus of experience in running this kind of business, and we have learned a thing or two about what makes people come to seek these services. First of all is accessibility. You must be able to get to the facility. Number 2 is the flow within the organization. In other words, all our clinics are arranged in such a way that you enter, usually to the left, exit on the right, and in between there you have the examination room, you've got the laboratories, and then you exit by the pharmacy. So all our clinics are designed using the experience we've had in the years that we've been in this practice.
Mm-hmm. Thank you, Chair. That is Dr. Frank Njenga. He's actually the chair of the AAR Group, and as he said, they are playing their part in making sure that they are partnering with the government in realizing universal health coverage. And speaking of the Ministry of Health, we have somebody who's representing it at this forum. Remember that AAR Healthcare are actually opening their 21st outpatient center here in Lavington. Please introduce yourself.
Thank you. My name is Dr. Laban Thiga. a Senior Deputy Director of Medical Services, working at the Ministry of Health.
And how important is this event for you in as far as bringing healthcare closer to the people and also helping along in realizing UHC?
As you are aware, UHC, or Universal Health Coverage, is one of the big four agenda of His Excellency the President. And there are three key pillars to that: affordability, access, and quality of care. And for us as a government, we are working with various partners, including the private sector, faith-based organization, development partners, in terms of ensuring that this universal health coverage agenda is delivered within the next 3 years. Part of the access and improved quality care, we work very closely with the private sector, and this 21st clinic by AAR Healthcare Group is one of those initiatives that we want to really allow the private sector for. We see it as a key pillar. It touches on the primary health care space, which is really the focus of UHC.
Okay, and just looking at this strategy, bringing the healthcare closer to the people, because the biggest impediment to accessing healthcare has been the distance to the healthcare facilities or even the personnel. So this coming closer to the people, what does it mean and what precedence is it setting for the rest of the industry?
It's a good precedent, I would say, and I want also to thank AAR Healthcare Group for that. As a policy, we want to ensure that people are able to get care within at least 5 kilometers distance from where they live. Even as we focus on curative services, specialized services, we are clear as a government that primary health care is core to delivering universal health coverage. Preventive, promotive care is also core in terms of coverage. Things like screening services, wellness clinics, that is primarily, the space that we see partners like AAR, taking up and playing their role, and we are glad to partner with them, as also we partner with others, the faith-based county governments, and all of us. We need to work together to deliver this.
Well said. Thank you very much. As you've heard, universal healthcare is a reality that Kenya needs to take up, and the first few steps towards that is the different healthcare providers doing their bit to ensure that this dream is actually realized for Kenyans. Again, we're coming to you live from the Lavington, to be specific, Westfield Mall, and this is where AAR is actually officially opening their 21st outpatient center, and this is a big step towards the right direction in as far as bringing healthcare closer to you. Now, that ceremony is just about to start, and that's why at this point I hand you over to the same, even as we listen in on some of the steps that AAR Group is taking to bring healthcare to you.
Welcome back, welcome back. So I'd like to take this opportunity to welcome the next speaker. This is a strategic management consultant. He's passionate about everything marketing. And he's a transformational leader. He's inspiring, he's focused, and he's the MD of AAR Healthcare Kenya Limited. Please help me to welcome Mr. Charles Kariuki.
Thank
Karibu, Charles.
Our chief guest, Dr. Laban Thiga, chairman of our group, and our friend, Dr. Frank Jenga, the group CEO of AAR Healthcare, Indran Puvan, the great team behind the big brand AAR Healthcare, the staff. Please wave wherever you are. Our neighbors here, tenants on this mall, and also our host, the owner of the mall, our invited guests and our very big supporting clients, all protocols observed. Good evening, it's good morning everyone, sorry. I think I'm quite excited to be here today, and especially to see our partners. Some of them were here. I can see my friend from MTN, Dan. Welcome everyone. As you've been told, today is the official launch of our 21st outpatient center. And we are very delighted. I'll make a few remarks about AAR Healthcare and what we do. But before I do that, I want to invite my senior management team who are here because they are the guys behind this brand. So I'll ask the team to just come closer to me here, the senior management team and all the health center managers who are here. I think sometimes as the leaders, we take glory for what is happening behind the scenes. Okay, because of time, I'll not introduce them, but this is the team behind the brand. Some of them are the health center managers for some of the facilities, and also we have the senior team from head office. I'll ask them to stand behind me so that I can feel confident when I'm making my remarks. Okay? So, AAR Healthcare Kenya Limited is a subsidiary of AAR Healthcare Holding, operating in Kenya. Currently, as I said, we have 21 outpatient facilities across the country, and we are still growing. We see over 300 patients the whole year, so you can see the impact we have and the people we touch across the country. We have a team of over 500 trained professional healthcare professionals, and with high level of skill, so to ensure that we deliver the service that we promise our clients. So our AAR Lavington Center opened on 12th November 2019, so it's been in operation. And I must say we've gotten a lot of support even from the owner of this mall. It's a beautiful mall, and you can see even in terms of other services happening. So the OPC outstanding feature is its location, as I said. Lavington boasts a homely, welcoming feel within this suburban setting, with a lot of apartments around this area, with high quality homes around, and complete with beautifully manicured gardens. Lavington is centrally located, easily accessible, and you can see even when you see the junctions of the road around here, numerous routes and several means of transport. We have many parks, sports clubs, schools, places of worship spread across the whole of Lavington. It also plays host to 2 embassies around here. So it will be difficult not to find Lavington an attractive neighborhood for us, and also a place to live in. We do have unique services across our 21 facilities. Just to mention a few, we have dental facilities, physio services, pediatric services, and other specialty services. We saw our physician here, Dr. Mogere. We have gynae services, dermatology services, ENT services, among many other services that we offer. So from what you've heard, we also have a big focus on wellness, preventive healthcare as an organization, because we also want to help people manage their health. And that's what we've been doing from morning. So this event has been, and we are happy to partner with NTV. It's been broadcasted live on NTV from 9, and that's where we started. So we are happy to continue sending this message across the whole country. So we've been running a campaign that we call the CARE campaign, and we reiterate that we are still open to all. If you look at some of the banners we have there, so AAR Healthcare, as used to be called, is no longer a members-only club. So we are open to offer services. People who have different medical cards from different insurance companies, people who want to pay cash, and we've also partnered with many other organizations. So this is in response to, and I'm happy we have government representation here, and the government is focusing on one of the big four agenda on universal healthcare. So that's why we continue to increase our footprint to ensure that we provide more access of our services and get closer to the people, and that is our expansion strategy. So we remain committed to providing healthcare solutions that make a difference to the communities where we live in. So thank you very much, and feel free to interact with our team today. And now it's my honor to invite the group CEO of the organization, Indran Puvan.
Good morning, esteemed guests. Welcome to the official opening of the Lavington AAR Outpatient Center. Approximately 2 years ago, when I joined the organization, I held a meeting with the investors. And they posed the question, Indran, what is your plan for the organization for the next 2 to 4 years? So I took a few minutes to settle my thoughts, and I shared my vision for the organization, which involved transforming the current organization into an integrated healthcare platform that operated across East Africa. In essence, I wanted the existing business to continue growing in footprint across the 3 countries in which we operate, namely Kenya, Uganda, and Tanzania. In addition to the outpatient services, I also wanted the group to diversify into private hospitals, something that I have vast experience in. So I pitched that in 2 to 4 years, I could see the organization consisting of approximately 50 outpatient centers and 5 private hospitals. At the time, our organization consisted of 34 outpatient centers and 1 hospital. I am proud to say that as of today, our organization consists of 40 outpatient centers and 2 hospitals that are operating in Uganda. And we've just commenced with the construction of our Greenfield Hospital situated in Nairobi. And the construction commenced with effect from January this year. So all in all, I'm extremely proud of what we've managed to accomplish. I must add that this accomplishment was as a result of the combined contribution of all staff across the countries in which we operate. I must also say I think that I've aged in the past 2 years as well. When I look at myself in the mirror, I see a lot more gray hairs than there was 2 years ago. But I suppose that's all part of the job. As an organization, we will always stay true to our mission, which is we provide healthcare solutions that make a difference to life. If there's one thing that I have observed over the past 2 years, is that all our staff have a commitment to our brand, that they treasure the brand extremely dearly. I truly believe that this is a differentiating factor that will ensure our continued success. I would like to take this opportunity to thank Charles and his team for a sterling job. It is extremely challenging to manage an existing business and to also grow that business in a very tough and challenging economic climate. So Charles and team, well done and congratulations. Can we please give the team a round of applause? Thank you. Lastly, I would like to extend a thank you to all our staff, as they are the backbone to our organization. At the end of the day, we are in the service industry, and service is all about people. Our staff are the ones who provide the service to our patients, and they are the ones who continue to be the ambassadors of our brand. With that, I would just like to say thank you for coming and being part of this celebration. Thank you very much.
Thank you, Mr. Indran Puvan. So our next guest He is a husband and a doting father and a doting grandfather. The only grandfather so far, right? He is an accomplished psychiatrist, an author, a mental health advocate and expert, and the current group chair of AAR. Welcome, Dr. Frank Njenga.
With your permission, ladies and gentlemen, let me speak to you as a grandfather. It's a position I hold with great cherish, because if you look at the demographic situation in this country, we are a diminishing demographic. So we're very few, and I would like to occupy that position. I can do that partly because I can actually tell you almost to the date and minute when this journey of AAR started. It started back in 1984 in some place by a guy called Bengt Beckman, who was a very good and old friend of mine. And his vision is what we are enjoying today. So we've been around this business now, if my arithmetic is anything to go by, about 35 years. And that, by any standard of any Kenyan company, is a good innings. I speak here also as chair of the board. And I would like to say the following, because it's completely true. AAR as a group is determined to continue investing in this country. We know that there are some cowards who have no confidence in the future of this very great Republic of Kenya. I would like to assure you, Laban Thiga, and you may transmit this message to the rest of government, that we are in this business for the long haul. As you've heard just now, in addition to all the clinics that are already in operation, we want to make ourselves available to the people of this republic. Now, I don't know how many of you live in Ongata Rongai. We are coming. I don't know how many live in Utawala. We are coming before the end of this year. And the great people of Kikuyu Township, with your new bypass, we are coming to you. That is in addition to all the other locations that we are at, including and not limited to Kisumu, Nakuru, Mombasa, South Sea, and other places. So our commitment to be where the people of Kenya live, we believe will act in supplementation, if there's such an English word, with the universal healthcare pillar of the government of the Republic of Kenya. So we shall be accessible, inshallah. We shall be, Indran, if you permit us, continue to be affordable, and Dr. Mpungu will ensure that we provide nothing but quality care. The hospital on Kiambu Road that you have heard about is one of our flagship activities. We are committed on this one to making sure that those companies that offer medical insurance cover have a hospital that they can truly call their own. Because we have some experience in insurance, and we understand, we believe we understand what the Aeons, the Britams, Jubilees, the Equities, KCB need to know about affordable product. And our hospital, when it opens, will be the first custom-built hospital that is completely friendly to the insurance world. Finally, I would like to say the following. We are Kenyans, but we have partners in this business. IFA, the Investment Fund for Health in Africa, is an equity fund that is a majority shareholder in this organization, full of confidence in the Republic of Kenya. IFC, the World Bank affiliate, full of confidence in this our country. Swedfund from the Swedish country, if you like, full of confidence and continuing to invest. There are some other very, very, very exciting activities that are, as we speak, taking place in and around AAR. I cannot tell you exactly what they are because they are top secret, but this I can tell you. They are exciting and confer in a formidable manner the confidence that we as a group have in the future of the growth of this Republic of Kenya. Now, I've been told that I should stop there, but I refuse to stop there because protocol now requires me to invite and request government to speak. Government cannot be asked to speak by this kind of young sister. It takes a mzee to invite government. Now, representing Dr. Wekesa Masasabi, who is the Director General of Health, is one of my friends. He tells me I used to teach him. I told him, no, I used to teach your teachers. Dr. Laban Thiga, who is a radiologist, and a man with whom I've spent some time here, and I am impressed, Daktari, first of all, by your commitment to universal healthcare, but also for working for our Republic of Kenya. So kindly please come and tell us whether we are doing the right thing in fully supporting universal healthcare in this our Republic.
Thank you very much, Group Chairman. As you've heard, my name is Dr. Laban Thiga. I'm here representing the Director General for Health, Dr. John Wekesa Masasabi. He would have really loved to be with you. He was actually prepared to come and grace this occasion, but because of an urgent engagement, he was not able to at the last minute. But he gladly, requested me to come and represent him, which I'm doing now. And I have some written points or a speech that he wanted to share with you. And I will go right ahead and read the speech. Chairman, the Board of Directors, board members present, Group CEO, management team and staff of AAR Healthcare, Kenya Limited, distinguished guests, ladies and gentlemen. I am delighted to be here and to join you as you launch this 21st Outpatient Center. Today's ceremony marks yet another milestone for the AAR Healthcare holding, and particularly AAR Healthcare Kenya Limited. And I would also like to extend my warmest congratulations to the AAR Healthcare fraternity for the sustained growth realized over the years. I think the chairman was quite happy and excited to share that you are doing now 34 years in this country. I take note that AAR Healthcare Limited is one of the largest providers of outpatient healthcare services in East Africa, with a network of now 21 outpatient centers across the country and serving over 650,000 clients annually within the region. We are also excited to know that you are confident of the environment that government has created, and you continue to invest with the hospital coming up. I take also note and commend you on the great work that you are doing in emergency care ambulance and rescue services. My heartfelt thanks also go to the board as well as the management and staff of the entire network for the dedicated efforts in offering quality health services to all throughout the years. Your focus of professional expertise, ethical practices, compassion, solidarity, and the entire process of recovery has ensured satisfied clientele, and is an area that government also wants to commend you on or for. The need for quality service delivery, even as we work hard to halt and reverse the rise in non-communicable diseases, remains a key government concern, and we can never be complacent. And we really appreciate as government that we have private sector that is working together with government in terms of ensuring that the government strategic objectives are met, especially around the issues of communicable diseases and now the non-communicable disease burden. And I'm sure as a group that is part of what you deal with on a daily basis. Ladies and gentlemen, we, the national and also the county governments, operate in resource-constrained budgets, and the investment to health care from private and faith-based organizations and development partners is something that we really fully embrace as government, and more so now with the UHC being one of the big four agenda. Distinguished guests, in order to meet the health-related development goals as well as our national development targets as envisaged in the Vision 2030, the Ministry is committed to implementing health systems reforms to accelerate movement towards the universal health coverage as a means of realizing the right to health, which is enshrined in our Constitution. Right to health is a constitutional issue. It is His Excellency the President's priority under the Big Four agenda, and we are happy that the private sector is working very closely with us. Our approach to UHC is centered on three critical drivers, which will focus on or are focusing on expanding the population accessing basic health interventions. This is an area as a group you are in, and I'm glad to note, as pointed out by the group chairman, that this is you are extending to where people live, Ongatarongai, Kikuyu, and the other places, and we thank you for that. The second critical driver is increasing access to healthcare services generally. That's another area, and also glad to note that there is a specialized care facility that is coming up in the next probably 1 year, by end of next year. The third critical driver is developing sustainable financing models for health, also pointed out by the group chairman. There's how do we fund our healthcare? As you are aware, the government is currently in the process of reforming our insurance fund, the National Health Insurance Fund. I know as private sector you are involved in that process through the Kenya Health Federation. Ada KEPSA, and we want to assure the sector that the kind of envisaged transformation of NHIF is really to ensure that our healthcare services, both public and private, are affordable. To accelerate the attainment of UHC in Kenya, the ministry will enhance multi-stakeholder and cross-sectoral collaborative partnerships, and would, as I've pointed out, this we are glad that we are doing it, through the structures that you have as private sector. Finally, distinguished guests and ladies and gentlemen, may I take this opportunity to wish AAR Healthcare Kenya Limited continued success in the years to come. May I also wish everyone and your families good health and happiness. At this juncture, I want to also declare that Lavington AAR Outpatient Center officially launched. Thank you very much. Signed, Acting Director General for Health, Dr. John Wekesama Sasabi. Thank you.
Thank you very much, Daktari. Let's give Daktari another round of applause. So now, at AAR Healthcare, we pride ourselves in offering high quality, affordable healthcare. And we are very happy to partner with the government to even be part of the universal healthcare agenda. Now, next on our program is the ceremonial opening of the outpatient center. But before I do that, I want to say that this outpatient center is very, very beautiful. It's a very beautiful baby. Yeah? It's only 8 months old. But I'm also informed that all babies are beautiful. Yeah? Now, if you're seated next to a lady, just look at her. I've given you permission. Tell her you're still as beautiful as you are as a baby. Now, if you're seated next to a gentleman, I've given you permission to look at them. Just look at the gentleman next to you and tell them or ask them what happened to you. So, it's at this point I'll ask my co-host, Dr. Mackenzie, to go down with our distinguished guests to help ceremoniously open the OPC. The rest of us can enjoy some music. Yeah.
Life is so easy. I've primed a good doctor that he just has to listen to what you have to.
Yeah, I have to listen to what
Yeah,
I've told him.
because he doesn't know. Too much. It's gone very well so far.
Yeah. So the meeting is only here for the next 13 minutes.
13.
Yeah.
I've learned many things from him. Okay. Williamson, that's your... Clinic.
Can go back up.
us to give him a moment so that they can take his vitals privately. So this is the triage, as we have mentioned, where all the essential vitals are taken, and the nurse will assess his state of health, and we flag them, being alert, red, which is high priority, and immediately get an emergency response of the team on the ground to attend to them. If we need to give any start medication, the nurse will give, find out how the patient is doing before we proceed on to the doctor. As said, we are still paperless, and the doctor will immediately get all this on his laptop. This is the waiting area. Once the triage has been completed and the doctor is accessing the first notes, he will be able to access the patients from here. We like that our patients see all our labeled rooms and all our services. If they have any queries, a client who wants to come in just for a malaria test will easily see that it's 20 minutes with or without a doctor's prescription, be able to access the lab on their own, and be able to get the result and be interpreted for. We can take a brief tour. This is our laboratory, easily accessible, easily seen and visible for all our clients. We would like them to know exactly what we deliver and how quickly and what their expected waiting time would be once they are here. Okay. Karibuni.
You have it, the official opening of the 21st Outpatient Center by AAR here in Lavington, and definitely specifically the Westfield Mall. And as you've heard from all the different speakers, is that AAR Group has been in operation for the last over 30 years, bringing healthcare closer to the people, and this is something that will continue as they partner with the government in as far as realizing universal healthcare coverage. We have been coming to you live from Lavington Westfield Mall, even as AAR opened their 21st Outpatient Center here in Lavington. Well, as you've seen from the brief tour of the facility, it is actually meticulously laid out to ensure that it gives a state-of-the-art experience for every patient that walks through its doors. This is replicated in the other 20 facilities across the country, and as you heard the chair intimate earlier on, is that they also have presence in the East African region, and also hospitals that are also coming up to help in providing healthcare for all and sundry. So even as we leave the government representative and the management of the AAR Group being given a tour of the first outpatient center courtesy of AAR here in Lavington, at this point we say adios, thank you for watching, and stay with NTV. My name is Gladys Gashanja.
This is NTV.
It's another week. It's Jamrock here on NTV, and this Saturday our guest Iman Zilla will be performing his latest track plus a one-on-one interview. Also, Jamrock Mtani tunadil na Art and Gravity. Bomb Squad crew will be in the building telling us more. And also, don't forget all your favorite reggae playlists from DJ Sejo. All this hosted by Crystal and Miss Katiwa. This coming Saturday. Remember, the hashtag is NTV Jamrock. See you this coming Saturday at 10 p.m.
Soil Merchants Property Developers have an incredible offer for prime 1/8-acre plots in Old Kalau Township. Welcome to our open day on 13th of July 2019. SMS plot to 21595. This week on The Trend, the controversial Vera Sidika will be here. The sassy Evelyn. Manolo. Tanzania sensational Dogo Janja.
Tonight we are dunda.